At its morning press conference Friday, the Central Epidemic Command Center addressed a wide range of issues, including problems with its contact tracing app, virus test kits being sold online, and the personal privacy of COVID patients.
Local COVID cases have surged in Taiwan, with case counts in the triple digits recorded for 14 straight days. With authorization from the CECC, local governments have been releasing information on their COVID cases. But with some releasing much more personal information than others, the CECC came out Friday to announce guidance on what can be disclosed.
In general, personal information is not to be disclosed. What can be disclosed is age and sex, but we've only been releasing the age ranges. In addition, with regard to the case's place of residence, only the name of the district is to be released. As for the patient's close contacts, we are only to report the number of family members and healthcare workers exposed. In principle, we should not disclose the person's place of work. If it is necessary to disclose it, then whether it's a public or private entity, there must be communication ahead of the disclosure. As for disclosing the venues visited by the case, specifics on private venues, one's own home, and other personal spaces are not to be made public. But if the person used public transport, then that can be disclosed, because there's a greater possibility and range of exposure involved. As for public venues, if that venue has implemented real name registration, then contact tracing can be conducted accurately. Because contact tracing can be done with precision, the name of such public venue should not be disclosed.
The CECC addressed a problem with its mobile app, which lets users know if a recent close contact tested positive for COVID-19. CECC Deputy Chief Chen Tsung-yen confirmed that as of May 24th, only 29 COVID cases had updated their status on the app. He said work would be done to improve the app's effectiveness.
Users have to download it, and the act of downloading it is voluntary. Confirmed cases and other contacts must have already downloaded the app before the app can generate an alert. Because this is a tool for COVID prevention and control, if a confirmed case wants to activate the alert, it has to go through the local health authority for data security purposes. During our national epidemic prevention meeting a few days ago, we reminded health officials of city and county governments to help confirmed cases update the app.
The CECC also addressed the rise of online listings, which purport to sell COVID rapid testing reagents. Chen said that selling such products was illegal and that all COVID screening should be conducted by medical personnel.
Today, all the quick screening tools approved by the Taiwan Food and Drug Administration are only authorized for use by medical personnel. Taiwan has yet to approve a single fast screening product for personal use.
In response to recent cluster infections at senior care homes, the CECC called on them to stop admitting new residents. If an admission is deemed necessary, the individual should present proof of a negative COVID test from the last 3 days and self-isolate for 14 days. Also on Friday, the CECC announced that its pandemic meetings with local officials will no longer be held every day, but rather twice a week on Tuesday and Friday.